Okay, everything to know about hair transplantation simplified by Nibli Skin and Hair Clinic. Local anesthesia is pretty straightforward. It's just injection of lignocaine plus sanchocaine so that this complete area will be anesthetized. This is the area from where we take the graft. This is the back of the skull. It's not painful as it seems because we are infiltrating all the anesthesia in this area. Okay, we come back to the scoring with the motorized device. What we do essentially with this is that once this region is anesthetized, you won't feel anything. So what we do is that with a motorized punch, we score each individual graft. Yeah, we'll see it in a little bit of zoom in the next slide. Yeah, see. Yeah. Once the scoring is done, the graft pops out. Yeah, see, graft has popped out itself. Okay, and we do this for 2500 grafts in an average session. And once the scoring is done, then the grafts are extracted. They are done by the force. I just pull them out. Come out is very easily after that. So once we have 2500 grafts in such a way, we try to start implanting them with the special implanters. This is where the frontal hairline is made. This area is again anesthetized, so you won't feel any pain. So one by one, the assistant provides me with the graft and I implant them to make a frontal hairline. The patient is absolutely comfortable, it does not feel pain or anything like that. Um, this is how patient looks, your typical patient looks before the procedure. We were treating this patient for this temporal recession, which was quite irreversible thing. It's gone quite deep inside. This is after the trimming of the hair. You can see the markings done. This hairline has gone deep inside, so we plan to cover this area. This is immediately after the transplantation. These are the grafts. However, to some it may look it's not that painful. More than 99% patients don't complain of pain after the procedure. This is growth what we can see after 15 days. So this area is filled up. This is how transplantation works. It's quite straightforward. There are a few questions. What should when the growth should be expected after hair transplantation? Hair growth usually occurs after 4 to 5 months duration. Some hair don't shed after the transplant, so that they start immediately growing. But that is an exception. Most of the hairs will shed after the transplantation. Um, Cost of hair transplantation again is a debatable thing. Everywhere the range of transplantation differs heavily. It may start as low as 30 rupees per follicle to 150 rupees per follicle. The downsides of hair transplantation, actually there are very few downsides on hair transplantations. If you do it in a right clinic, which maintains the high surgical standards, you don't have any downsides or problems with hair transplantation. Just to include what may happen if it is not done correctly. Improper implantation of the grafts will result in graft loss, and hence you won't grow any hair as a result of that. Improper design will lead to a bad cosmetic outcome. Yeah, that's very obvious. You don't want hair growing from different angles. You want all them to come straight out of the scalp. Any surgical procedure will have infection as a side effects, especially in the clinics where you don't see high surgical standards, cleanliness standards maintained. It won't happen in a standard clinic. That's it. Thank you for watching the video.